Berberine in bodybuilding, the science, benefits, and risks. In bodybuilding, the focus is often on anabolic hormones, protein synthesis, and training volume. But sometimes the most powerful performance enhancers are not anabolic at all. They are metabolic. Berberine is one of them. Today, we will break down the precise biochemical pathways through which berberine impacts glucose metabolism, insulin sensitivity, fat oxidation, and potentially even muscle growth, and whether it deserves a place in a serious athlete's supplement stack. Section 1. Berberine's mechanism. AMPK activation. The primary mechanism of berberine is the activation of AMP-activated protein kinase, often called the body's metabolic master switch. AMPK senses the energy status of the cell. When activated, it shifts the body from energy storage to energy utilization. Berberine indirectly activates AMPK by inhibiting mitochondrial complex 1, causing a mild drop in ATP and a rise in AMP. This triggers a cascade that increases glucose uptake into muscle cells, enhances fatty acid oxidation, improves insulin sensitivity, reduces liver glucose production. In bodybuilding terms, AMPK activation helps shuttle nutrients into muscle cells more efficiently while reducing fat storage, a dual effect that is highly desirable in both cutting and lean bulking phases. Section 2. Blood sugar control and nutrient partitioning. Berberine is often called nature's metformin because of its impact on blood sugar regulation. For athletes, the significance lies in nutrient partitioning, directing calories towards muscle tissue instead of fat. Berberine increases GLUT4 translocation to muscle cell membranes, enhancing glucose uptake post-meal. It reduces postprandial, or after-meal, glucose spikes, leading to a lower insulin demand. Lower baseline insulin plus better sensitivity equals a metabolic environment favoring muscle preservation and fat burning. Practical example: during a bulk, berberine may help reduce the fat gain that often comes with high-calorie diets. During a cut, it can help maintain stable energy levels and preserve muscle mass. Section 3. Fat loss advantages. AMPK activation from berberine also promotes fat loss through increased mitochondrial biogenesis. More mitochondria means higher oxidative capacity, enhanced beta oxidation, burning fatty acids for energy, reduced lipogenesis, lowering new fat formation in the liver, and suppression of adipocyte differentiation, making it harder for the body to create new fat cells. This is especially valuable in the final weeks of contest prep, where even small improvements in fat oxidation can make a visible difference in conditioning. Section 4. Muscle growth. Indirect support. Berberine is not anabolic in the traditional sense. It won't directly increase testosterone or stimulate mTOR the way resistance training or leucine does. However, its effects on glucose disposal and inflammation indirectly support hypertrophy. By improving insulin sensitivity, muscle cells receive more glycogen and amino acids post-workout. Lower chronic inflammation improves recovery capacity. Stable blood sugar levels reduce cortisol spikes, creating a more anabolic hormonal environment. Interestingly, some animal studies suggest that chronic AMPK activation can inhibit mTOR, but in the context of berberine supplementation in trained athletes, this effect appears minimal when combined with regular resistance training. Section 5. Cognitive and endurance benefits. Berberine's benefits go beyond body composition. Improved mitochondrial efficiency equals better muscular endurance. Stable blood sugar equals more consistent mental focus during long training sessions. Potential neuroprotective effects may help with mental fatigue during calorie restriction. Section 6. Scientific evidence in athletes. While most berberine research comes from diabetic and metabolic syndrome populations, emerging studies on athletes show promising results. 8-week trial in healthy, active adults improved insulin sensitivity and reduced fasting glucose without changes in calorie intake. Endurance study in mice improved time to exhaustion, likely due to better mitochondrial energy efficiency. Anecdotally, many bodybuilders report fuller muscles during carb refeeds when using berberine as a glucose disposal agent, GDA. Section 7. Dosage, timing, and cycling. Common effective dosage 900 to 1500 milligrams per day, split into 2 to 3 doses with meals. Key considerations: take with carbohydrate-containing meals for maximum glucose disposal effect. Avoid taking it right before heavy carb depletion workouts, as excessive AMPK activation during training may theoretically reduce peak anaerobic output. Some athletes use berberine in 8 to 12-week cycles to avoid potential gut microbiome adaptation. Risks and side effects. While generally safe, berberine is potent and can cause gastrointestinal discomfort, especially at high doses, potential drug interactions, particularly with medications affecting blood sugar or blood pressure, risk of hypoglycemia in combination with other glucose-lowering agents, and limited long-term safety data in healthy athletes. As always, medical guidance is essential, especially if you have pre-existing conditions. Conclusion: berberine is not a magic muscle builder, but as a metabolic optimizer, it offers unique advantages for bodybuilders: better glucose control, improved nutrient partitioning, enhanced fat oxidation, and potentially greater muscle preservation during cuts. Its real power lies in making your diet and training more efficient. Like any tool, it's only as good as the system it's used in, but for athletes chasing the leanest, most muscular physique possible, berberine might just be the missing piece in the puzzle.